Chair, how are you? Good. Thank you.
The board members now.
Sure. Yes, my officer.
Down.
Allow me to hug this.
You know this one.
Yes, hello. Batia.
Yes.
Thank you. Fred, how are you? Good. Right here.
Good, so the board is ready, waiting for you.
Great. Thank you very much. My PS, Harry Kimtai, now the PS in charge of medical services. Chair of the board, Mr. Irungu Nyakera. Members of the board present, and this is a full board. The new acting CEO, Andrew Mulwa, and members of the Fourth Estate, good morning. I am pleased to be here today to announce to the country that following the appointment by His Excellency the President of the new chair of the board, as well as the nomination of members of the board by myself, I have hereby just concluded inauguration of the board and given them the full mandate to drive this institution to where it is supposed to be within the constitution of this country. I have highlighted to them the vision of this country. I have highlighted to them what the plan is for Kenya Kwanza government on delivery of universal health coverage. And I have directed them that for us as a country to achieve universal health coverage, this institution plays a key role on ensuring that health facilities within this country are adequately, optimally stocked with the essential products that are required. This board has been carefully selected by the President and by myself. And I have something to say about each and every member of this board and why they are a member of this board. So I want to let Kenyans know that the board that we have in place, I am convinced that they are the people who are going to clean up this institution and ensure that it delivers on its mandate, to ensure that we have health products and technologies, that Kenyans can access medical commodities at their facilities at the most affordable price and whenever it is required. I want to mention that specifically the chair here has accolades on what he has achieved in other institutions. And him and I, we have one thing in common, that we both are members of the Academy of the most influential persons of African descent who are influencing healthcare. It is not a mean achievement. And to let Kenyans know that he has an experience on matters governance, having worked in the US, equally having worked in this country as a principal secretary and lastly in charge of national planning. Therefore, this institution is going to benefit from his immense expertise and skill. Equally, we have 3 independent board members who have a lot of skill and expertise that I expect them to put into this institution. We have CPA Omolo, who is an accredited accountant, and not just a CPA, but a fellowship. There are very few in this country. These are people who have keen eyes to details on matters auditing of systems. Therefore, we expect you, Mr. Omolo, to put in your expertise to this institution. We have Mr. Bett, who has served as a member of the REREC board. He was also in the 11th Parliament, representing people, and therefore he is here to ensure that Kenyans' needs are met. And lastly, of the 3 independent board members, we have Dr. Jane Masiga, a renowned pharmacist who has served Mission for Essential Drugs and Supply for the longest, I think close to 30 years, if I'm not wrong. More than 30 years. And she is the immediate former managing director of Mission for Essential Drugs, which is the second largest organization, institution in this country on matters of healthcare supply chain. And therefore, I have no doubt that with her skill, experience, expertise, she's going to inject the same in this institution. We have other board members. I know Jane Batia, a representative of COG, a lawyer by profession, and we expect her to ensure that whatever is done within this institution is done as per the Constitution. We have an independent, we have another member who is a representative of Treasury, Madam Jane, and I expect you to put in a keen eye as well to ensure that public funds are well spent. Chemwile is an alternate to the PS, and since the PS is here, he'll do his job. Who haven't I mentioned?
The ex-official.
The ex-official, the CEO. Many people asked me why I settled on Dr. Andrew Mulwa. Yesterday we launched a report, and one of the counties that was highlighted as having very good indicators on matters healthcare was Makueni County. Kenyans, many do not know that the engineer, the pioneer CEC for health for Makueni County was Dr. Andrew Mulwa. And it is based on that skill and expertise that I settled on him to act in the position of the Chief Executive Officer to be able to steer this organization to the next level. And myself, I am a supply chain expert, healthcare. So I believe we have the right team to ensure that we assist the president to achieve his mandate, but most importantly, to ensure that Kenyans access health commodities as and when they need it at the most affordable price.